So welcome everybody. This is our Class U webinar with Louisa James, our friend from Northern Star Insurance Advisors. She goes over Medicare mostly today is what we'll be covering, but also she has some other lines of business that will be outside of the scope of great picture this presentation. But Louisa is one of our Class Professional Network members. For those of you that have heard that term before, Klaas Financial, as you know, is your financial planner, kind of covering multiple areas of your financial life. Some lines of business we do ourselves, such as the financial planning and the investment management, as you know, but we like to bring in other local trusted professionals like Louisa to help our clients with to round out other areas of their financial lives. And as you can see, this topic will be on Medicare, which for most people is a very important topic as you approach that age 65 and beyond there. So my name is Nate Brybe. I'm an advisor here in the Rockford office. We're also joined by Alyssa Ebert, who is a financial planner in our Rockford office as well. And like I said, we have Louisa James with us today to go over Medicare. So most of the names here, we recognize that most of you are probably clients of the firm. So just a little bit of a background on Klaas Financial. We've been in business for 48 years now, founded in 1976. We serve over 1,000 different client households in a total of 33 states. So two offices, one in Rockford here and then one up in Madison, but we serve clients all across the country. So I think that's all I need to say, Louisa, about Klaas and kind of how you fit in. And we will turn it over to you, like I said, to start the presentation. I guess one more note to the participants. We can't hear you, so everyone's muted, obviously, with no video. So if you do have a question, like I said, you can either write in the chat or the Q&A box at the bottom of your screen as we go through the presentation. If we have time at the end, you can use that raised hand feature and we can unmute your line and you can ask a live question. But other than that, feel free to type in questions as Louisa goes through this. This is a complicated matter that I learn something every time she goes through it, which is good. So, but we're excited to see what's new and hasn't changed maybe for this year. So go ahead, Louisa.
All right. Hi. Thanks for that. I'm Louisa James. I guess quick, I had two screens here, so I want to make sure you guys are seeing like the PowerPoint Medicare 101 slide, right?
Yes.
All right. Yeah, so I've been in the insurance industry for almost 12 years now, and I started Northern Star Insurance Advisors just about a year ago. So just a little about me. I specialize in helping individuals and families navigate their health insurance options. This presentation is going to be specifically on Medicare. I can kind of nerd out on Medicare, so I could talk like for hours about it, but I'm going to really try to keep it to the basics, Medicare 101. Obviously, as Nate said, feel free to ask questions if, there's something that you specifically have. So I guess one other thing, we're located downtown Rockford, Illinois, but licensed in multiple states. So thanks to technology, we can work kind of all over the country. It's a good thing. So kind of kicking things off here. When does Medicare start? Everyone is, oops, it didn't switch here. Doesn't look like it. You're still seeing Medicare 101, right?
Yes.
Okay, hold on. All right, sorry, technology. There we go.
There we go.
I was gonna say, when I say we, I'm usually the person that if anyone calls into Northern Star, I deal with the insurance and stuff like that. But my husband Jonathan does a lot of the technology and the website and stuff, so I'm learning. So when does Medicare start? You're actually first eligible at age 65, or in certain circumstances, if someone is on Social Security disability for 2 years, they can start that earlier. That does not mean that you have to take Medicare at 65 in every situation, though. For a lot of people, that can make sense to do so, but in the situation where a lot of people are still working or they're covered under a spouse's employer plan, and that specifically if that employer plan, the employee has over 20 employees, then you don't necessarily have to take Medicare. You can keep working, stay on the group plan with no penalty. You can just initiate it later. Does that make sense to do? That's always situational. So best to just kind of check with an independent advisor, see, calculate out the numbers, which option makes more sense. So, and then as I kind of alluded, if I delay Medicare, will there be a penalty? And I get that question all the time. Specifically, if you're covered under an employer plan and that employer has over 20 employees, you won't be penalized for delaying Medicare. But in other cases, when someone works for a smaller employer, or maybe they're just on the marketplace or they're retired, you'd want to go ahead and start Medicare at that time. So next thing, well, what does Medicare cover? Medicare is made up of two parts, A and B. A is the hospital side of things. B is the medical side of things. Cost for that. Most people who have met their 40 working quarters, or at least worked in some part-time fashion for about 10 years, have already paid into their Medicare Part A, and so they don't owe a premium for that. That'll be a zero premium for that. Part B, though, most everybody pays a premium for, and the standard amount this year is $174.70 a month. So that can be more based on income from the last couple of years that I will get into in the next slide here. Medicare Part B, again, everyone pays at least this $174.70 a month unless they have, qualify for some other financial assistance. But something that I come across where people are surprised is if they, as like maybe a couple, make over $206,000 within the last couple of years, their Part B premium is actually going to be more than that standard amount. So I kind of, maybe it's a little small, but there's a grid that shows, your income and what your Part B premium is going to be accordingly. So just something to know as you're preparing to retire and go on to Medicare. I will mention, and again, try not to get into too much detail, but there is a way to, because this Part B premium is based off of your income from 2 years ago, there's a lot of situations where people are retiring and their income is no longer going to be, in one of those higher brackets. So in that case, there is a way to kind of catch up that income amount. They usually go by the IRS records, but there's an appeal form that kind of helps Medicare catch up your income and show that that's no longer going to be as high as it was. Let's bring it back down to the standard amount, or something like that. So that's a potential thing to come across. What does Medicare cover? Part A, as I said, is more the hospital inpatient kind of coverage. Specifically covers anything when you're in the hospital, skilled nursing care, short-term nursing care, not long-term care, home health, some level of home health care services that also is somewhat limited, so kind of bleeds into long-term care from there. Hospice. Part B is more outpatient coverage. So you'll get a welcome to Medicare exam when you first go on, an annual wellness visit every 12 months, labs, x-rays, blood work, medical equipment, orthotics and prosthetics, mental health, ambulance services. Again, anything really outpatient kind of falls in the Part B category. Overall, between A and B, they roughly cover about 80% of hospital and medical expenses. So where an advisor can come in is help fill in the other 20% of hospital and medical expenses, any prescription coverage, dental, vision, that sort of thing. Because although Medicare is pretty comprehensive, and when you do sign up for Medicare, you'll get this big, thick book called Medicare and You that lists out all the Medicare approved expenses. There is a short list of things that Medicare does not cover. So therefore, we would need to have fill in the gaps. I mentioned already, one of those things is long-term care. So most like skilled nursing care after 100 days. Most dental care is not covered by Medicare. Anything really routine vision is not covered by Medicare. So Medicare does cover anything major medical, like with an eye specialist, anything related to like glaucoma treatment, cataract surgery, macular degeneration. Medicare does cover those, but it doesn't cover the routine treatment. So your annual exam to get your prescribe your glasses, eyewear, that sort of thing. That's usually a separate supplemental piece. I mentioned dental, dentures, not covered by Medicare. Anything cosmetic, not covered by Medicare. Acupuncture, a lot of like some of the integrative medicine out there isn't usually covered by Medicare. Hearing aids, surprisingly, is not covered by Medicare, usually a supplemental piece as well. And then routine foot care. Most other things are, again, Medicare and You is like this thing. So how can you fill in the gaps? Really, there's two main ways to do that. Take all the advertisements you see out there, any mailers you get, and you can really put them in one of two piles, one of two categories. One option is filling in the gaps with a Medicare supplement, sometimes called a Medigap plan, and then also adding a Part D prescription plan to that. The other option is getting a bundled Medicare Advantage plan, sometimes also called Part C. Those really are the two main options. Everything kind of fits into those categories. There's pros and cons to each. Everyone has their opinions on them. So my goal is always to just highlight, the black and white, like pros, cons, pricing and all that. And then, everyone has their decision on what they want to go with from there. There we go. So kind of starting off with the Medicare supplement or Medigap option. These are typically going to be the higher premium option, so a little higher upfront cost, but typically lower out of pocket on the back end for hospital and medical expenses. They're all labeled by letters for most of the country. So I gave some examples. As an educational meeting, I can't give like specific numbers and stuff, but I just kind of threw together some averages in our area. So in this example, typical Medicare supplement for a male age 65 in the Northern Illinois area. I show a plan N, G, and F. So all that can get really, confusing. It's like a big alphabet soup, but essentially a Medicare supplement covers the other 20% of Medicare approved expenses. So Medicare pays their part, and then they kick it off to the Medicare supplement to pay the rest. So the fullest level of coverage that people can get, and actually anyone who turned 65 prior to 2020, is called a Plan F, where their out of pocket for Medicare approved expenses is nothing. There's no copays, no deductible. If you hear anyone who says, I just don't pay a bill, usually it's a Plan F, but it comes with a heftier premium. And these go up as people get older too. So usually it's age-based. I'll just say the new Plan F that's available since 2020 for anybody who's turning 65 now is Plan G. And the only difference is that, there's no copays, but there is a $240 annual deductible that needs to be met. Other than that, it works the exact same way as Plan F. And then, as with anything, if we're lowering premium, usually we're adding some kind of out-of-pocket cost on the back end. There's usually some kind of trade-off there. So the last one I will go over is Plan N, which you still have the $240 annual deductible, but then you have some added potential copays, usually up to $20 for like doctor visits, up to $50 for like an ER situation or an ambulance. But again, that's the trade-off for bringing the premium down in those plans. So those are kind of three of the more popular ones right now. Again, pros and cons between a supplement and an advantage plan. These supplements, usually you're just looking at lower out of pocket for hospital and medical. Plan G, your out of pocket is $240 for hospital and medical. You're done, but you're paying at least $100 a month for it typically. The other pro is that your network is Medicare. So I think the latest stat was that like 96% of the doctors in the country take Medicare. All the hospitals do. So you usually don't have to ask, do you take this Medicare supplement? It's, do you take Medicare? And if so, they take the supplement. With that though, because Medicare does not cover pharmacy drugs, if you're on a supplement, you have to add an additional Part D as in drug plan to have that coverage. Medicare will cover a lot of the drugs while you're in the hospital, a lot of your expensive injections or infusions while you're in the doctor's office, but it doesn't cover your maintenance pharmacy drugs. So that's a separate piece if you're looking at a supplement Medigap plan. One kind of large change that has happened lately within the just Medicare drug plan space is, I don't know if anyone has heard someone talk about the donut hole, but that is no more as of next year. There used to be no cap on out-of-pocket expenses for prescriptions while you're on Medicare, technically. Now, next year in 2025, there's a hard cutoff of $2,000 per person. So $2,000 is still a lot, but considering where it came from in the past, where I've had people who are like 7,000+ in some cases, it's a difference. So just again, one thing to note going forward with Medicare prescription plans. And then going over to the other type of plan, Medicare Advantage, also called Part C. There are several different main differences between what I just went through in a supplement and what a typical Advantage plan looks like. One of the main things is network. So with a supplement, I mentioned you can use it anywhere that takes Medicare. Medicare Advantage plans are usually going to be HMOs, PPOs, and again, just you really want to utilize a network in order to not overpay on anything. One of the pros of an Advantage plan is going to be premium, usually in most cases. These are kind of the plans that you'll see advertised for maybe $0, $10, $20 a month. They don't all fall in that, but a lot of the competitive plans are usually going to save you upfront in premium money. And then you pay on the back end in the form of copays. So I can't go into like specific plan details on like what does copays mean, but typically, an average plan, the primary doctor visit maybe means $0 or $10. A specialist visit might be $20, $30. Labs or x-rays might be $10, $20, but you get into bigger things, usually you get into bigger copays. So MRI might fall between like $200 and $350 or so. Every plan's a little different. But the point is that they're usually taking what's a high bill and bringing it down to a flat copay in an Advantage plan. So you're just kind of paying as you go, depending on the service. And then you have an annual max out of pocket. So it's not like you could just get into the hundreds of thousands of dollars with all these copays. You pay up to your maximum out of pocket. Most of the plans that we see, at least in Northern Illinois, are going to fall between like $3,000, and then the most they can have this year is $8,850 for an in-network max out of pocket. So again, that's kind of the trade-off there. As you're bringing down premium, usually you have some more potential out of pocket on the back end. And then one of the last things that Advantage plans are kind of known for usually, or at least they're advertised for, is the extra perks that Medicare doesn't cover. A lot of these plans have some kind of dental built in or routine vision, some hearing aid coverage, over-the-counter benefits, maybe a gym membership. Again, they're all a little different in that, but that's kind of what a lot of them are known for, is just those extra built-in benefits for no additional premium in there. So again, there's pros and cons to all this. It's all going to be up to personal preference and situation, but some pros of the Medigap Medicare Supplement plans is freedom to use anywhere that takes Medicare. No referrals necessary, can go get a second opinion pretty easily. Low out-of-pocket cost on the back end. So as I mentioned, the new Plan F is G is your out-of-pocket for hospital and medical expenses is $240. Once you've met that, you're good for the year. So anything Medicare approved. In most cases, no pre-authorization to get MRIs or surgery like that. I ask any of my medical billing friends or a lot of the doctor's offices, a lot of them say, oh yeah, Medicare just kind of, pushes things through a lot. So cons, higher monthly premium. You look at a typical Plan G, you're paying at least $100 a month for that. Depending on your prescriptions, Part D can come with a premium as well. You usually have to, if you want dental, routine vision, some kind of hearing aid coverage, you usually have to add that for additional premium. So that can kind of nickel and dime up and be a little heftier on the front end in premium. So Medicare Advantage, pros and cons. Pros of Medicare Advantage plan in most cases, again, is low monthly premium, and then the extra benefits that they build in, instead of paying extra premium to have a dental and vision plan and all that added in, a lot of them just come with it. Cons, can be more limited network, again, because these are usually HMOs, PPOs. PPO usually means that you have a large nationwide network, probably more like a lot of you have on an employer plan. So it can work throughout the country. It's just that you want to make sure your doctors are in network in order to not overpay on anything. Higher potential out of pocket. Again, most of these Advantage plans, your out of pocket max is going to fall between like $3,000 and $8,800 depending on the plan. So just need to be aware that that's your potential risk out of pocket for the year. And then the third here is, Advantage plans are managed care plans. So what I mean by that is it's not necessarily Medicare, although you have to have Medicare to be on one. If you're on an Advantage plan, you're with the insurance company. So whatever that insurance company is, they're managing that care. Medicare is not. So usually you're dealing with their pre-authorization rules for an MRI or a surgery or whatever that case is. Just a difference in that.
Louisa, can we go back to that for the Advantage plans? So does Advantage plan would replace original Medicare, correct? A and B. What
Yes.
happens to that Part B premium, and would someone still be subject to IRMA if they were on an Advantage plan?
Good question. Yes. So you're paying your Part B premium no matter which way you go. It's just outside of that, you're making your decision. So if you have that IRMA, that income related monthly adjustment, that higher premium for Part B, you're going to pay that either way you go.
Okay. Does the Advantage provider get some of the Part B premium, or is that still retained by Medicare?
They do.
Okay.
They
And
do.
that's what supplements, because that's what we see from our perspective as clients come in saying that my Advantage premium is significantly lower. So how does that equate with extra benefits? Obviously, some of that's hedged on the back end with deductibles, co-pays, and things like that. But, so they get some of the premium, but how do they get more for less premium? You see what I'm getting at? I guess
Right. It's like, how can you have a zero premium plan and offer, $2,000 of dental benefit and all that? Well, some of that money that's going to Medicare is then transferred to the Advantage plan company, and they're assuming the risk. They're administering everything on an Advantage plan.
That makes sense then. Yep.
Yeah, they're getting their money somehow.
Yep.
It's not for nothing. Yeah, so just some things to consider. And again, this is always an individual decision. Your health. If you see multiple specialists in a month and just have multiple chronic conditions and stuff, maybe you might want to budget that up front in the premium and then not worry about hitting a max out of pocket every year. Or how often do you see doctors, specialists? Those co-pays can add up on like an Advantage plan. Your prescriptions can make a difference. Either way you go with a Medigap and a Part D plan or a Medicare Advantage plan that builds in prescription coverage, those plans are going to kind of work similarly. but we want to make sure your particular prescriptions are covered and how they're covered. You know, one might be lower cost than the other for those particular prescriptions. So it's just a factor to consider. Do you travel often, or do you live in 2 different states? You know, is it just going to be easier to go anywhere, or do you want to make sure doctors are in network in each of the places? So it's, you know, do you want flexibility of network in that case? What's your monthly budget for insurance? Like if you want the, you know, more flexible network, but you just frankly can't afford $100 a month. I mean, that's another thing to consider. And then are the built-in extra benefits important to you? You know, the dental and vision and all that stuff too. So just all the questions that go into making a decision on this. Oh, and that's where I left off there.
Very good.
Yeah.
Looks like we had so yeah, obviously we were to the Q&A part. Louisa, we had one question that got typed in there. Alyssa, do you see that one? You want to go ahead and ask?
I do.
Oh, okay.
Oh, sorry, I don't have to. Yeah. How does
The
Medicare work
question
for?
was, how does Medicare work for covered veterans?
Yeah, so typically if a veteran has like VA coverage, you can keep that, and you know you will have to add Medicare in addition to that, but you don't have to. So I was saying you don't have to have like a supplement or advantage plan if you don't want to, because the VA coverage, you should be able to just use that. And then specifically for prescriptions in the VA, you won't be penalized for not having any kind of prescription coverage because the VA coverage already takes care of that. Now, with that being said, there are, you know, a lot of, with VA coverage anyways, you usually have to utilize a VA like hospital. So if someone wants flexibility outside of that, they can look at an advantage plan, supplement, that kind of thing, or using a pharmacy like Walgreens or something instead of VA. So there's just different kind of situations in that.
Thank you.
Mm-hmm.
So yeah, everyone who's joining, if you have a question, you can type it in the bottom in that Q&A function, or if you prefer to ask it live, you can use that raise hand feature at the bottom, and then we can unmute your line, and then you can talk directly to Louisa if you have a question that's maybe easier to explain verbally. So so feel free to type questions in or raise your hand at the bottom there, and then we can unmute you to ask a question. I guess
will mention TRICARE as well is pretty, I mean, full coverage. It's a lot of people like that coverage, so you don't need to get rid of it or anything. It just would work in conjunction with your Medicare. I have a few people who they have to get on Medicare, but Medicare and the TRICARE together are pretty full coverage, so we don't often need to add something in addition unless it's like a separate dental or something like that.
We had a question on scheduling with you, how to make that appointment, and then are the appointments with your services free?
Yeah, great question. So a few different ways. I feel free to email me, call me. There's a spot on the website as well, northernstaradvisors.com. It would either be myself or my assistant Blythe answering the phone, scheduling stuff. So any of the above. And there's no fee for it. So my incentive in all of this is, you know, I like to educate people on their options, but assuming you end up going with a certain company, all the companies, whether you go directly through them or you go through me or another agent, you're paying the same. But if you go through me, I get a commission from the company. So that's my incentive in all of it.
Thank you for explaining that. And then I had someone ask how far in advance of turning 65 they should begin the process.
Yeah, that's also a good question. So I usually say 3 to 6 months. 6 months is probably a little early, but I have a lot of people who they just need the numbers and need to plan for that, and we can totally do that. I like being ahead of schedule, but I have a lot of people who are 2-3 months ahead of time, and we get everything done in plenty of time. So.
And then,
Yeah.
Louisa, a popular question would be, once they're past 65, can you go over open enrollment? If they chose a supplement or chose an advantage plan and they wanted to switch vice versa, can you go over that, how that would work?
Yeah. So once you're already on Medicare, then every year there's an annual enrollment period for Medicare, actually coming up October 15th through December 7th. And that's specifically when people can shop out their Part D prescription plans, their Medicare Advantage plans, anything like that. Medicare supplements can technically be reviewed at any time of the year. So we can always take a look at those, but anything with prescription or built-in prescription coverage kind of has to be done during the annual enrollment period. So definitely want to get those done before December 7th.
And even if you weren't interested maybe in switching from advantage to supplement or vice versa, Louisa, is a good idea to review what you have regardless? Can you
Usually,
take the premium and coverage, like it's pretty universal, correct, for a supplement of Plan G?
yes. So specifically for supplements, a Plan G is the same coverage across the board with all the companies. It's just that they're going to differ in their premiums. So usually if you start a supplement, again, Plan G, Plan N, whatever it is, you're usually pretty competitive for the first 2-3 years, but those rates go up a little every year, just like home and auto or anything else. So after 4 or 5 years plus, I had someone who had not reviewed in 20 years a few weeks ago. You're likely overpaying for them for the same coverage you could potentially get elsewhere. You can review those at any time of the year. The caveat is, in order to get some of the lowest or the most competitive pricing, there can be underwriting questions involved. But that's the other part of what I do. Just based off of medical questions, I can help you determine what you can and can't do. It's usually worth a look, though.
A question that just came in is, in order to switch from Medigap to Medicare Advantage after being on Medicare, is health history a factor?
No. So Medicare Advantage plans will never ask medical questions, or they haven't for years and years, and they aren't. Supplements are really the only ones that can do that.
Okay. And following that, if you choose Advantage plan, can you switch back to a supplement, a Medigap plan without medical questions or medical review? How about the opposite scenario?
Yeah, that's a good question. So that is very situational. So if you're started with an Advantage plan, and then wanted to switch to a supplement, technically, so when you first go on to, if you first turn 65 and go on to Medicare, you have a year trial period to jump on a Medicare Advantage plan, test it out, and then within that year, switch to a supplement plan for no medical questions. So that's one situation. The other would be I guess you'd said also starting with a supplement and then going to an advantage plan, you can always do that at an annual enrollment period, no medical questions asked, because advantage plans don't ask medical questions. Yeah, hopefully I covered all that.
So the risk, Louisa, would be after a year, right? After that
Yes.
original grace period, that would be the risk, right?
Yes, yep. So if you started with an advantage plan or tested out an advantage plan after the fact, you always have kind of that 1 year trial period. After that year, then most insurance companies for supplements are going to ask medical questions. They're all a little different. So we just go off of the medical questionnaire. In Illinois, we have one guarantee issue company. That means there's no medical questions. They're just a little higher premium because of it. So they're always in our back pocket. But in other states like Wisconsin, Minnesota, Texas, there are no guarantee issue companies. So medical questions could be a hurdle to getting back on a supplement if you've been on an advantage plan for longer than a year.
Sure. Perfect. Well, good. Great questions, everyone. And we still got a little bit of time here. So if anyone has any further questions, the Q&A again at the bottom, or the raise hand feature to ask a question live. While we're waiting for any more of those to come in, Lisa, anything else we didn't cover about your services or Medicare that you want to mention, or unless any questions from you?
No, I don't know if you'd
Yeah.
mentioned it. I guess I just wanted to also note that Louisa helps prior to Medicare also if you are retiring early and need that gap coverage before you begin Medicare. If you're not looking at Cobra, she's a good resource there also. And if nothing else, knows who to reach out to for other resources in that capacity. So I think more unique, tailored advice she'd be able to give off the screen, but I think this was a great 101 session. Very, very helpful. Thank you.
Yeah, you're welcome. Yeah, just to kind of add to that, there's a lot of situations where, when a couple, one spouse is eligible for Medicare, but maybe one isn't, or both, or just one person, whoever, is not yet to Medicare, and you really just need those numbers to know how much your health insurance is going to cost before retiring. That prior to Medicare, it can really vary according to your income on what's going to be available to you for health insurance premiums. So that's a big portion of what I do, is just kind of running different numbers and calculating out what that's going to cost too. So
Yep. Exactly. Well, good. Well, I think we'll close up shop for today. And for those of you that were on at the start, we did record this, so it'll be on our website in a few weeks, along with our other prior webinars as well. And keep your eye out on your email boxes. We do have a few more this year yet, it seems like. So we tend to do, I don't know, half dozen or so of these per year. So keep an eye on your inboxes for more in the future. And once again, Louisa, thank you so much for the presentation, and hope everyone got your contact information. If not, be sure to ask us next time you're in the office, and we'll forward you on down to Louisa. So thanks, everyone. Have a great night.
Thank you guys.
thanks for having me.